All right. Well, welcome everyone. My name is John Zalk. I'm VP of Marketing for Solara Medical Supplies, and along with Tony Bloise, our partner with Dexcom, we are happy you've joined us today. This is actually the first of our monthly educational webinars. Look for this every month. We're going to have a different topic, and we want to make them relevant for you. Today, Janice Baker, Solara's certified diabetes educator, is going to discuss effectively managing your diabetes. If you aren't familiar with Solara, we are the largest distributor that's focused exclusively in diabetes. So we've got a broad offering of products and supplies and services. And we're in the process of really expanding our educational offering. We really want to be your single point of contact. So, in addition to what your physicians are providing and the manufacturers are providing, we want to be that single point of contact and that resource for you, for education, for questions around diabetes, around managed care, whatever your needs are, and we'll be looking for feedback at the end to give us the topics that you want to learn more about. But without any further ado, let me turn this over to Tony Bloise with Dexcom.
Thanks, John. Appreciate that. And just in terms of a logistical overview, if you have questions, we'll have time at the end for live Q&A. But if something pops up, you also can add or just put in the chat feature your question, and we'll address those as well. But by way of introduction, I'm super excited to be here. My name is Tony Bloise. I am a training manager with Dexcom. I've been with Dexcom for a little over 3 years, and I've been working in diabetes for a long time. And I'm a person who gets a lot of satisfaction out of helping parents and caregivers and patients that have diabetes manage their diabetes more effectively. So I'm very excited to be here today to tell you a little bit about a solution, the product that we have, the Dexcom G6, and how that may be able to help patients manage their diabetes more effectively. So I will now turn it over to Janice.
Hey, good morning, good evening, wherever you may be. My name is Janice Baker. I'm a registered dietitian, certified diabetes educator, certified nutrition support clinician, and board certified in advanced diabetes management. And I've been working in the diabetes field for over 35 years, which speaks to the type of changes that I've seen. And I can honestly say I'm still absolutely thrilled to be working in this field and being a resource for you. I've seen a lot of changes in diabetes management therapies, and our aim is to make your life as simple and as high quality as possible. And I'm very, very honored to be a resource for Solara Medical Supplies. If you would like to reach us for any questions regarding diabetes, you can reach our diabetes educators, including myself, at cde@solaramedicalsupplies.com, and we do look forward to your questions and seeing how we can help you out. So to start, we're going to be going through our presentation. I'll be starting first, and then we'll turn our presentation over to Tony. And again, please let us know if there's questions that we can answer for you. So the title of this program is Diabetes Management, specifically for type 1 diabetes in the pediatric population. We have goals of diabetes management that we do review. And again, the goals are very individualized, but primarily, number one is to promote normal physical, psychological growth and development as age goes on. And this, of course, is throughout the whole lifespan. Avoid short-term and long-term complications of diabetes, optimize quality of life, minimize worry and fear related to low and high blood sugar and diabetes complications, and to promote independence and self-management skills as appropriate for age and developmental stages. And again, this varies from child to child, from person to person, and each person's situation is very unique, and that's why we're here to support the recommendations of your physician and healthcare team. Type 1 diabetes, just as a definition, is considered an autoimmune disease. This means that high blood sugar is caused by lack of insulin, which is caused by the destruction of insulin-producing cells in the pancreas. Now, type 1 diabetes is only 5 to 10% of all diabetes cases. The rest are divided into type 2 diabetes, gestational diabetes, and of course, there's many other forms of diabetes, but type 1 diabetes is the focus of our presentation today. Type 1 diabetes is diagnosed mostly below the age of 21. The peak incidence occurs during puberty. However, it's important to realize that type 1 diabetes can occur at any age, even in older adults. Oftentimes, this can be misdiagnosed, but we generally see mostly below the age of 21. So nutrition is always a very big topic of interest. As a registered dietitian, we know there's many, many aspects to healthful eating and good nutrition, but the key points, especially in the early years of life, is to meet nutrition needs for growth and development, having a healthy relationship with food and eating, accommodate cultural, economic, and taste preferences, awareness of hunger and satiety, and glucose management in balance with insulin and exercise. The last two bullet points are very interesting to me because over the course of the years of working with diabetes, I clearly remember early on in my career when we actually didn't even have glucose meters. People would need to eat even when they didn't want to. Children would be told to eat even if they were not hungry, just to make sure they weren't going to get into a dangerous situation with their balance of insulin and their blood sugar levels. And the last point also, I can expand on this by saying that, you know, there can be as many as 42 different effects of on blood sugar. You know, insulin and exercise are two, but as we're going to be talking about is sleep, there's medications, other medications that may come into play. There may be other illnesses, colds. There can be life changes that can affect blood sugar. So this is a very dynamic situation, and there's many, many moving parts. Activity goals are very important because, as we know, physical activity is associated with improved heart function, bone health, strength, mental health, and increased insulin sensitivity. This is especially concerning at this point in time because, as we know, many, many influences have developed that really decrease how active people are, starting even from an early age. And we know only 40 to 50% of 6 to 11-year-olds and only 8% of adolescents meet physical activity guidelines of 60 minutes of high-intensity physical activity per day. And unfortunately, this tends to decline as time goes on. That can lead to further difficulties with healthful weight management, blood sugar management, and increased risk of other coexisting problems like heart disease and loss of strength. So with activity goals, we often encourage all ages, not just children, play, informal movement with games, music, art, crafts, hobbies, dance. And this is very important for neuromuscular development as well as blood sugar improvement. We see even problems with even hand muscle development when there's too much electronic activity being done. Because a lot of children, as I'm told by some teacher friends, don't even have the muscles developed in their hands to hold pencils and crayons. So we do want to encourage things like working with blocks, Play-Doh, dancing, crayons, art supplies, because that even impacts the muscle development in the hands. And then other things like dance and outdoor play help develop and stimulate the muscles in the rest of the body. And we do know that when the muscles are used, the insulin is used better, blood sugar tends to be much better controlled. We do encourage sports and athletics, which involve social skills, goal setting, activities like swimming, gymnastics, soccer, basketball, many other activities, of course. And we want to make sure kids are able to try these, see what they enjoy, see what they really feel is the right fit for them. Not everyone's an athlete, of course, but the bottom line is we do want to encourage activity and discourage too much sedentary activity. I want to bring up the issue of sleep, which is often under-recognized as a very big impact on blood sugar. And the study of sleep science is showing more and more how much lack of sleep or poor quality sleep can impact blood sugar management. It is a risk factor for poor diabetes control. We do know that lack of sleep can increase insulin resistance, which gets more of a problem as time goes on. In many of my adult patients, we see very poor sleep correlated with high blood sugar, high cholesterol, and high blood pressure. So it does impact a lot of cardiovascular risk factors. We do know that less healthful food choices and erratic appetite can be a result of poor sleep. Being tired and fatigued can reduce motivations for self-care, as well as increased use of caffeine. We're seeing a lot more use of energy drinks, coffee drinks at younger and younger ages, which can set up for even more problems with sleep, more addiction to caffeine, which is a drug, which can affect also cardiovascular risks. And lack of sleep and fatigue can also increase depression and depressive symptoms, which unfortunately diabetes can also increase the risk of. So it is an additive effect. Factors affecting sleep, some we can control, some we can't, but one that's being looked at, as a matter of fact, is school hours. There are movements to help delay the time that school starts because we're seeing that impact on children and young adults, as well as adolescents, academic load, extracurricular activities, and we need to realize that hormone changes, especially around adolescence, can definitely affect sleep patterns, but also hypo and hyperglycemia, high and low blood sugar, because when blood sugar is low or high during the night, of course, that causes more awakening for glucose checks, frequent urination, even problems with bedwetting, which very much disrupts sleep patterns. Also, needless to say, the use of electronic devices such as phones, computers, and tablets, that in itself can delay sleep times and it can interrupt normal sleep quality. So that's a very important factor that is relatively new to sleep problems, but is definitely a very big impact. So some suggestions for sleep improvement, including one that I've used as a parent. I've raised 3 children, we're all in their 20s now, but a media curfew, so to speak, can be very effective. Regular bedtimes, bedtime rituals, which are good. All of these are good for anyone, diabetes or not. We could all use better sleep hygiene for better health. But also bedside treatment for low blood sugar, such as glucose gel, juice boxes, glucose tablets to quickly and effectively treat low blood sugar. And then last but not least, of course, is the technology that we now have. That is such a blessing to parents and children alike, is our continuous glucose monitoring technology, which can definitely help with better outcomes, better blood sugar management, and alleviating oftentimes the fear and the glucose variability that can disrupt sleep, as well as other factors in the quality of life of those with diabetes. So with that, I'm going to thank you for attending this section of our webinar. I do want to remind you that you are welcome to contact us for questions at cde@solaramedicalsupplies.com. And with that, I'm going to turn this over to Tony, who's going to expand on the use of technology, specifically continuous glucose monitoring for those with diabetes. Thank you so much.
Thank you, Janice. Appreciate that. I'm going to just switch the presentations here. For those of you that aren't able to see the slides, if you just dialed in on phone, I'm going to try to be descriptive in describing what's on the slides as I'm working through just a few slides that we have. Okay, so I'm very excited to have an opportunity to talk a little bit about continuous glucose monitoring, but I would be remiss if I didn't give a shout out to Solara Medical Supplies for this opportunity. Very grateful to be able to share with you some information about a tool that is available for patients and caregivers of patients that have diabetes to help them manage their diabetes more effectively. I'm going to speak in really simple terms, and so I apologize for people that may be pretty familiar with the technology because it may be really general and simplistic, but I want to make sure that I'm speaking about things in a way that if you're new to it, it'll make sense to you, and hopefully if you're a veteran and well-versed in the technology, you'll still be able to get something from it as well. So over the course of the next 15 minutes, what I want to talk about are, what are the goals for patients and caregivers when they're managing their diabetes? Why do we care about glucose levels? Why is that important? And then specifically talk about what continuous glucose monitoring is and the Dexcom G6. Just by way of background, I work for Dexcom. Dexcom is a company based here in San Diego, where we are today. And we only have one product. It's the Dexcom continuous glucose monitor. We've been in business since 1999. We're singularly focused on helping patients and caregivers of patients with diabetes manage their diabetes more efficiently. So the first slide I have up is actually a picture of a windy road. And this is where I'm going to apologize for oversimplifying the goal of managing diabetes, but I think that this picture is a great illustration to help people visualize what it is they're trying to accomplish in managing diabetes. So if you think of diabetes and what is it you're trying to do over the course of the day, essentially what you're trying to do is keep your glucose level in the normal range. And the normal range is different for different ages, but generally speaking, you're wanting to keep it between 80 and 130. And for those of you that drive, you know that when you're driving on a road, on the edge of the road, they have rumble strips. So if you get off the edge of the road, your tire will run over those rumble strips and it'll rumble, 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 and it'll alert you to know that, oh, I need to get back over to stay on the road. And so that's really what managing diabetes is you're trying to keep your glucose level between the rumble strips, if you will. And that's where continuous glucose monitors can come in and help you with that information. Because quite frankly, if I asked you what's your glucose level right now, you probably wouldn't know. You would have to guess. And the great thing about the Dexcom G6 is that it gives you visibility to what your glucose levels are 24 hours a day, 7 days a week. And I'll talk about some of the features that it has that have been really popular with patients. But essentially, what you're trying to do is over the course of a 24-hour day, you're trying to keep your glucose level in that normal range for as many of those 24 hours of the day as possible. And that's where continuous glucose monitoring can help you because it gives you visibility to what your glucose level is all the time. So a couple of things that you're trying to avoid or you're trying to stay within the rumble strip, stay on the road, because bad things can happen when you have excursions, when you go outside of the normal blood range. Short-term complications are things I want to mention first. And everyone is aware of low blood sugar, also known as hypoglycemia. So that's when your glucose level gets really low, you don't have enough energy and glucose to your brain, and your body functions start to shut down. So the symptoms that you experience when your blood sugar gets very low are you get shaky, you get nauseous, you get mentally very confused, your heart rate can increase. And so those are some of the symptoms that you experience as a patient. And even if you haven't had diabetes before, you've probably experienced that if you've missed a meal or two and have experienced that. But that can be very serious because if it's not addressed and your blood sugar continues to get lower, bad things can happen. And by bad things, I mean you can go into a coma and ultimately you could die. So that's something that we definitely want to avoid. On the other end is high blood sugar, and that's called hyperglycemia, and we want to avoid that as well because there are very serious long-term complications associated with having your blood sugar at an elevated rate for years and years. So if you have high blood sugar for 15, 20, 25 years, then bad things start to happen in your body, such as loss of vision, loss of kidney function, which could result in you having to go on dialysis, loss of blood circulation to your extremities, which results in amputation of toes, feet, and legs. And you also have an increased risk of heart attack and stroke. So those are downstream complications that we want to avoid. And the way we avoid those is keeping it between the rumble strips on a day-to-day basis to keep the blood sugar in the normal range for 24 out of the 24 hours of the day, if possible. That's the goal. Okay. When I talk with patients and I ask them to describe, the different things that impact their glucose level over the course of the day, they almost always come up with the big three, if you will. And Janice did a great job of outlining some of the other variables that impact blood glucose that people don't really consider. But they almost always say, oh yeah, food impacts my glucose. And of course, they're right there. But different types of food can impact your glucose levels in different ways. Like, for example, a supersized sugary drink is going to impact your glucose level differently than if you eat a steak. So not only is it food, but it's the type of food that you need to consider. People almost always say, well, my medicine, of course, impacts my glucose level, and they're correct there. And they almost always also guess correctly that exercise does. So exercise can have an impact on your glucose as well. But there's a number of other variables that impact blood glucose level that most people aren't aware of. Things like the weather outside. Is it really cold or is it really hot? That can impact your glucose level. How much sleep did you get last night? Are you under a lot of stress? Are you sick? So all of these variables impact your glucose level on a daily basis to a greater or lesser extent. And the real challenge is that today is different than yesterday. So even if you ate exactly the same thing and took exactly the same medicine at the same time, your glucose level is going to be different today than it was yesterday because of all these other variables that impact it. And the only way you can know what your glucose level is to have visibility to it. Otherwise, quite honestly, you're just kind of guessing what it is based on how your body's feeling, which we know is not a reliable indicator. So that's the power of continuous glucose monitoring. As I mentioned a little bit earlier, the Dexcom G6 provides you a new glucose reading every 5 minutes, 24 hours a day, 7 days a week. So day and night, you have visibility to what your glucose level is. It can do a number of things to help you manage your diabetes by doing things such as reducing your A1C and the incidence of hypoglycemia you experience. And then it also can reduce the amount of variability you have. You're really high, then you take too much insulin, and then you go really low, and then you eat a lot to get it back up, and then you go really high again, and you're on this roller coaster. So if you have visibility to what your glucose level is, you can modulate that and control that so you're in a steady state in your glucose, and with, again, the goal being to keep it in that normal range for as long as you can. So what is continuous glucose monitors? I'll explain what they are in just a minute in terms of the components and how they work together to give you this information. But essentially, they have three components. They have a sensor, a transmitter, and then a display device. The sensor is a very small medical device that the patient puts on themselves. It's about the size of a Lego, so it's fairly small. Patient puts it on themselves, and what I mean by that is that there is a small sensor wire about the thickness of 2 human hairs that goes just under the skin. And most people wear it on their abdomen. although some people wear it other places. Parents actually put it on their kids on their upper buttocks so they don't peel it off. And you'll see a lot of people actually wear them on their arms as well. At Dexcom, we don't have any studies where we've tested it why people wear it on the arm, so we can't recommend that, but you'll see a lot of people do wear it on their arms. And so they put on the sensor, and then they snap in a transmitter. And so what happens is their glucose level goes up that sensor wire into the transmitter. The transmitter wirelessly transmits that data to a display device, which can be a receiver or your smartphone. And on that display device, you have a trend graph that you can see what your glucose level is. And so on the slide right now, I've got an example of what a trend graph would look like. But each one of those dots represents a new reading, and every 5 minutes you get a new reading. And you can see up to 24 hours of data at a time. But it's really helpful because not only does it give you the number where your glucose is right now, but more importantly, it gives you the direction that your glucose is heading and how quickly it's moving in that direction. So now you can make a more informed decision on how to manage your diabetes. So the slide that I have right here is an example of the exact same patient over a 24-hour period where one day they used a blood glucose meter. And you can see in this particular example, they did a finger stick and used a blood glucose meter 4 times over the course of this day. And the gray shaded area is the normal range where patients want to stay. And so when the patient happened to check their glucose level, they just happened to be in the normal range all 4 times over the course of this day. So at the end of this day, I'm sure they're feeling ecstatic about good they did today, in managing their diabetes. They're thinking, this is fantastic. Every time I measure my glucose level, I'm in range. What a fantastic day it was. But of course, what they don't know is what their glucose level was doing between those finger sticks. And as you can see in this example, they actually had excursions to the high side twice and then to the low side once. And they weren't even aware of it. So what they thought was a perfectly fantastic day, one of their best days they've had in a long time, in reality, it was actually not a very good day. And so that's a challenge when they go in to see their doctor, and their doctor gives them an updated A1C, and before they read them the results, they say, well, how do you think you've done? And the patient would say something like, oh, I've done fantastic. I'm in range almost all the time. And then they see that their A1C has actually gone up, and they're frustrated and they don't understand why. That's why, because they don't know what their glucose level is doing between the finger sticks. So also on this graphic is an overlay of the same patient who was using a Dexcom G6, as represented by the green dots. And as you can see here, they stayed in the normal range for the entire 24-hour period. And what they were able to see here, as their glucose level was edging upwards, they had visibility to that, and they could see, oh, I'm heading a little bit higher. I need to take action. So that action for me is going to be either exercising a little bit more, going for a walk, or I'm going to take a little bit more insulin to lower that. And then as it started to go down, as it was getting low, then they knew, oh, gosh, I better eat something. Or else I'm gonna have a hypoglycemic event. I want to avoid that. So they eat something and they go back up a little bit and they stay within the normal range. So that's the power that CGM can bring patients, is it's informing them of what their glucose level is so they can make more informed decisions about how to manage their diabetes. That's really the power of it. So the Dexcom G6, here's a picture of what it looks like. You can see the applicator there. It looks like a mouse that you use on your computer. That's where the sensor is, and it's very simple to use. It's exactly what you would think. You press that big orange button, and within 1/16 of a second, it puts the sensor wire just under your skin. Most patients don't even feel it. And then you would take the transmitter, snap that in, and then connect it to your display device. And within a short period of time, your trend graph starts to appear, and you've got visibility to what your glucose level is. With the Dexcom G6 in particular, some of the features that patients absolutely love about it is that they don't have to do finger sticks anymore. The accuracy of these continuous glucose monitors has gotten really impressive over the last couple of years as the technology has advanced. I think I mentioned we've been making CGM devices for a little over 10 years. The 6 and the Dexcom G6 is generation, so this is our 6th product that we've had out over the 12 years. And as each new iteration has come out, Dexcom 1 to 2 to 3 to 4 to 5 to 6, there's been improvements and enhancements made. And one of those enhancements has been accuracy of the sensor. And so they're very accurate. They're as accurate or more accurate than blood glucose meters. So the Food and Drug Administration said, you know, you don't need to use finger sticks anymore because this continuous glucose monitors is that accurate. So you can dose your insulin off of it and have confidence that the number is a good number. So no finger sticks is very popular. The sensor lasts for 10 days, so they have to replace that every 10 days, and I'll show you what that looks like in just a minute. It's very simple to put on. It has a number of alerts and alarms for people to let them know when they're going high and low, which has been very popular for patients. And it's small in terms of what the footprint is on the body. And as I mentioned, it uses wireless Bluetooth technology, so there's no tubes, there's no wires, no connection at all. It's completely wireless. And another great feature of it is that it fits right in with your daily life. Once you snap in the transmitter, it becomes highly water resistant. And by that, I mean you can shower with it, you can bathe with it, you can swim with it, and literally be under 8 feet of water for 24 consecutive hours, and it will still function. So it's a great system to fit in with the lifestyle of patients because it's so durable. So some of the key features that I just wanted to, on a real high level, go over are with each component. So if you can see this slide, this is what the applicator looks like, and then that's the sensor that's attached to it. So when they push that big orange button, then they take the applicator away, and then that's disposable. The sensor is placed on the body. It has adhesive on it that keeps it in place for the 10 days. And after they put that on, then they will put on the transmitter. So as I mentioned, we are approved for the abdomen, and then kids can wear it in their upper buttocks. A lot of parents place it there on their kids so they don't take it off themselves. So it is indicated for children aged 2 and older, which is a great feature where we've done studies in the pediatric population. So that's how we were able to get that indication all the way down to 2. So it's so easy to put on. It's really 4 steps. On the applicator, the sensor is at the bottom of it. You peel the label off, exposing the sticky adhesive. You place that on your abdomen. So you peel, place, and press the button, and it's on your body. And then you just snap in the transmitter. And if you can see, that's what it looks like. And as I mentioned, it's about the size of a Lego. So it's fairly small, which is important for people because they don't want this great big huge monstrosity of a device on their body. But almost everyone is willing to wear this because it's so small. To remove it, you do exactly the same thing in reverse. You just peel it off like a Band-Aid. The sensor wire is very small. It just pulls out and comes right out. The sensor is disposable, so after 10 days, you would just discard that, and you would keep the transmitter portion, which is good for 3 months. That lasts for 3 months. Okay, I want to talk about 2 different features that are really popular with the Dexcom G6. One of them is our alarm. So I mentioned just a minute ago that patients can set alerts on the high side or low side so that their display device or their phone will beep and vibrate if they exceed that, or they can elect to not use the alerts if they don't want to. But there's one alarm that's on the system that they cannot shut off. It is a factory set alarm that will go off at 55 milligrams per deciliter. And I can tell you that the FDA loves this feature because it is a great safety feature for patients. So what it does is if a patient's glucose level goes below 55, it will beep. Their display device, their receiver, or their phone will beep and vibrate until their glucose level goes above 55. It'll continue to do that every 5 minutes until they go above it. So the FDA and patients have described this as a safety net. So patients love it because most often when a patient experiences a low glycemic, hypoglycemic event, it's at nighttime. So they're already sleeping, they're not awake and consciously checking what their glucose levels are. And so if it drops below that, now they know that their Dexcom's got their back, it's gonna beep, it's gonna vibrate, and it's gonna wake me up. And then they typically keep a fast-acting glucose, by their bed so that they can get some glucose in them quickly. So you may be wondering, well, why 55? How did you pick that number? 55 was selected because when a patient's glucose level goes below that, their mental status really slows, and they typically need a second person to come and assist them. So we try to alert them just before they get to that point of no return so that they can do the things they need to do to get their glucose level back up. So that's an alarm that's factory set. You can't turn that off. They love that. So what we've had patients tell us was, hey, we love the alarm. That's a great safety feature for us. But what would be really helpful is if we had a little bit of lead time, a little bit of warning that we were going to go that low so we could get ahead of it rather than reacting to it after it happened. And so with the G6, we came out with this alert called the urgent low soon alert. And what this will do is if a patient is on a trajectory where they're going to hit 55 within the next 20 minutes, it will alert them. It will beep and vibrate. And that essentially tells the patient, hey, you're dropping really fast. You need to take action now. And so this is a new feature on the G6, but the feedback that we've gotten so far has been very popular. We've gotten a lot of comments from patients on how this has really helped them, and they really appreciate having this feature on there. So that's why I wanted to mention it to you. All right. Another great thing about the Dexcom G6 is that you can use your smartphone as a display device. So people like this for a number of reasons. They like it because it's very discreet. Not everybody knows that they're checking their glucose level. When I'm looking at my phone, I could be checking a text or an email or checking my Snapchat account. So kids in particular like it because they don't want to announce to the world that they have diabetes, and by using their smart device, no one has to know that they're checking their glucose level. So that's one feature that's very popular. So it works with both Apple phones and Android phones. There's an app that the patient would download on their phone. It's free, and it's very intuitive on how to walk through the app to get it set up so that you can use your smart device as your display device. So another feature that is really popular, probably the most popular feature that we have for parents with children that have diabetes, is our share feature. So if the patient uses a smart device as their display device, then they can share that data with up to 5 followers. So the follower, which is typically a parent, would download a follow app, which is also free. And then the patient invites them to follow, and then the parent can see the child's glucose data in real time. And it doesn't matter if they're in the next room or if they've just gone to college and they're three states away. So that's the great feature about the share feature, is that it's real time. You see the same thing that the patient sees, and you also get the same alerts and alarms that a patient would get. So it's a very popular feature because for the first time, parents can see what their kids' glucose levels are when they're at school. They can have overnights and go to camp. And then, of course, when they're away and far away, parents can still follow them and keep up and make sure that they're safe. So very popular feature, and one that we get a lot of comments from people on how much they enjoy that. That's in this, if you can see this, this is what the parent or follower can see. Again, up to 5 people can follow one patient, so they can have visibility to what their glucose levels are. They see the same thing the patient does. Another feature that's popular, probably more with physicians than it is with patients, but it's a Clarity app. This is another app that patients can download onto their phone. And as you can imagine, if you're getting a new glucose reading every 5 minutes, 24 hours a day, 7 days a week, that generates a lot of data. And doctors love data. So you can share your data with your clinician through the Clarity app so that they can see what your trends have been over the last 30 days. And then they can help manage your diabetes in terms of making adjustments to your medicine and your diet and things based on the data. So it's a treasure trove of data. Clinicians love it, and that's a popular feature as well. All right. In summary, I just wanted to mention a couple of things about the Dexcom G6 that patients really like. One is it's very accurate. It lasts 10 days. It's approved for kids age 2 and older. It's very simple to put on and has a small footprint on the body. The share feature is very popular for parents. The new urgent low soon alarm is a new feature for G6 that's been very popular also. And of course, the safety net feature of the alarm that goes off at 55. So there's a number of aspects that I didn't get into on this, but what I'm going to do now is turn it back over to Janice, and she's going to close us out, and then we'll be happy to answer any questions that you may have.
Thank you, Tony. Your overview and explanation of the Dexcom CGM was fantastic. And actually, this is one of the greatest advances we've had that I have seen personally as a diabetes educator since the early 80s in a long time. As I was thinking about it, I started when we had no finger sticks for not so great reasons. And now we're back to where we have the choice of no finger sticks for a very good reason. And what I see in my practice in working with people of all ages with diabetes is our passion is to help you enhance your quality of life, minimize stress and anxiety, help you do all the things you want to do with just much less fear and despair. And we know diabetes is a full-time job. It's exhausting. It causes fatigue. You want to break from this. So while we're not totally there yet with a cure, we're getting closer and closer to helping make your life as high quality as possible. I also want to remind you, as I mentioned earlier, that we're very happy to take your questions either here or if you would like to email us at cde@solaramedicalsupplies.com. We'll be very happy to be resources for you and do our best to service you and provide education and other resources. So we'd like to answer any questions if there's any.
Check the chat feature as well and see if anybody had any questions there. Janice, why don't you get us started? What are some of the common questions that people have that are newly diagnosed?
Well, in terms of the questions I get, of course, the first thing is often, what can I eat? Because diabetes is so food focused. And while we used to say, and again, I remember this a long time ago, well, you can't eat sugar and you can't eat this, it was all about what you can't do, which that's a drag, right? If you're just constantly told you can't do something, you want it more. What we know now, and the standards of care in diabetes management do reflect this, is nutrition for those with diabetes must reflect the individual's need. As I mentioned before, culture, financial aspects, your lifestyle, your growth and energy needs, and we want to respect what you enjoy. We also do know that good nutrition, no matter whether we have diabetes or not, is essential for protection from cardiovascular risk factors, kidney disease, healthy weight management, and again, supporting our quality of life. So food-related questions are very common. Unfortunately, also, there's a lot of confusing, conflicting information out there on what people should eat. And the role of a registered dietitian is to help people sift through that and apply to themselves. So again, we don't have unnecessary fear and anxiety about food and eating.
Great. I've got a question that we get often here, and that is, is this, how much does a continuous glucose monitor cost? Is it covered by insurance? Great question. The short answer is it most likely is covered by your insurance. It has great coverage for patients with type 1, and most insurance companies are now broadening the medical benefit to include patients that have type 2 diabetes as well. So the best way to find out is we're happy to do a benefits investigation for you, and by that I mean contact your insurer on your behalf to ask if they provide coverage. You can call them yourself and ask, but the short answer is it's great coverage, and a lot of patients are benefiting from it already. And if you have any questions on that, we can, Solara Medical Supplies and Dexcom, we can help support you in that.
I'd like to make another comment about what we reviewed today. I personally have worn for a few days the Dexcom G6. I've worn pumps. I don't have diabetes, but I've worn many devices and many glucose monitoring systems and tried many finger stick glucose meters because I feel as a diabetes educator, I must experience these. My latest experience with the Dexcom G6 was, this is so easy. This is so wonderful. I can see what's going on. And I was checking the app on my phone. And again, the real-time feedback, the use of a device where we don't have to poke their fingers, I think is just such a great advance. I just was saying, I want to put this on all the people with diabetes that I work with. And this includes even my seniors who, for many reasons, do need to check their blood sugar several times a day, but have difficulty with finger sticks for many reasons, and dexterity and even visual issues. So I'm very excited about the technology advances. The warnings of impending low blood sugar is another fantastic development that we know can avoid much more serious issues. And as we were mentioning before, the A1C is just one marker of blood sugar control, but what we're realizing now, it does not tell the whole story. We're looking much more at what we call time and range, as well as decreasing glucose variability, which in itself is a very much a physiological stressor. So when we can have good A1C, but know that it's because of more time and range, that's really what we're trying to achieve. I want to remind people we can have a good looking A1C with a lot of variability that can cause actually a lot of stress to the body. So the fact that we can see variability, as Tony explained so well, that's a very big advancement.
All right. Well, it doesn't look like we have any questions in the chat box. I can open the floor for just a minute if anyone has any questions that you'd like to ask over the phone. If not, that's fine. As Janice alluded to, you can submit your questions to the website. You want to go over
Yes,
that
you
again?
can submit your questions to cde@solaramedicalsupplies.com. I want to thank everyone for joining us today. We appreciate your time and your attention, and we look forward to seeing you at future webinars.
Thank you.